When the first stage of labor starts, when the woman is going to go through the onset of labor, the cervix becomes spontaneously it comes out. If it is not coming out even after 45 minutes of delivery of the baby, so this can last, this particular stage, first stage can last for Hello everyone, this is Dr. Abhinaya from Sai Ram Fertility and Maternity Clinic, T Nagar. Today we are going to see about the stages of labor. Lot of my patient questions regarding what is labor, how many stages, what is called stages of labor. So there are actually 3 stages of labor. First stage of labor is when the cervix, which is the mouth of uterus, starts to dilate. So first it becomes, generally the cervix, which is the mouth of the uterus, is firm in consistency and it is tightly closed to keep the baby safe inside. So when the first stage of labor starts, when the woman is going to go through the onset of labor, the cervix becomes very soft and it is becoming thin and it starts dilating. So first stage is up to 3 centimeters of cervical dilatation. During this phase, the women will have mild tightening of the abdomen, mild pains, low back pain, and profuse cervical discharge. The release of mucus plug happens during this stage, and they can even see a pinkish or blood-stained vaginal discharge. So this is the symptoms, this is the indication that she is going through this onset of labor. So this can last, this particular stage, first stage can last for few hours to few days depending upon the women's body. So during this phase, the women can very well stay at home, have adequate rest. They can walk around, they can do normal physical activity, they can do all the pregnancy yoga, stretches, they can keep themselves very much hydrated, and they can wait for the proper onset of labor. So first stage is also called latent phase because there is no vigorous contractions. So once the woman crosses 3 centimeter, she is entering an active phase of labor. That means second stage. So second stage is still from the 3 centimeter dilatation to full dilatation of cervix, which is almost 10 centimeters, and the delivery of the baby. Delivery of the baby completes the second stage of labor. So during this phase, the women will experience stronger contractions, frequent contractions. So some women will tend to stick onto the bed. They don't want to walk around, but we still encourage them to walk around, do all the prenatal yoga, stretches, whichever is making them comfortable. They can listen to the music they love. They can have lot of liquids, not a proper solid food, but they can have lot of liquids, and they can we can start monitoring the frequency of the contraction, intensity of the contractions, baby heartbeat and all we start monitoring. During this phase, mostly the women will be in the hospital because of strong pains. So once the baby delivers, that ends the second stage of labor. Third stage of labor is the expulsion of placenta. Placenta comes out after 10 minutes to maximum 45 minutes. Spontaneously it comes out. If it is not coming out even after 45 minutes of delivery of the baby, then the gynecologist removes the placenta manually. So that ends the third stage of labor. Sometimes we also involve another stage in this duration course of labor, that is fourth stage, which lasts for 2 hours after delivery. We will make sure that the women's vitals, pulse, BP, everything is normal. She is not bleeding too much. If there is any tear or if there is any lacerations or episiotomy is there, we have to suture that area, make the women comfortable and pain-free. Latching, the baby's first breast milk, we will encourage the women to feed the child. We will ask her to walk around. If she can pass urine, that is well and good. So this is the fourth stage. After 2 hours of expulsion of placenta, monitoring the women's vital, encouraging her to breastfeed and making sure there is no abnormal profuse bleeding PV. So this ends the labor phase. Thank you. Thank you for watching.